Director of Social Media in the Ministry.
It is the turn of the Lagos State Ministry of Health to give a breakdown of its one-year achievements at the state's 2025 ministerial press briefing organized by the Ministry of Information and Strategy.
360 public health facilities.
Top on the list for the State Commissioner for Health, Professor Akin Abayomi, is the steps taken to reduce brain drain and increase brain gain for medical professionals, as well as the state's government plan to reduce maternal mortality.
One of our key indicators of progress is maternal and infant death, and we're currently have the best indices in the country of 430 per 100,000 live births. In other words, 430 mothers still die in Lagos out of 100,000 trying to give birth to their children. For us in Lagos, this is an unacceptable number, and we've declared a zero tolerance on maternal death in the process of childbirth. Our target over the next 20 to 30 years is to bring that number down from 430 to 37. When we look at number of Lagosians that are covered by insurance, at the moment we're hovering around 5% of the population in a mixture of social health insurance and private health insurance. And over the next 20 years, our target is to have majority of Lagosians carrying some form of health insurance. So we have a significant problem in terms of human resources for health. It is not unique to Lagos. In fact, Lagos is better off than most states and better off than many countries across Africa. However, Lagos is the city of excellence, and so we are planning very strategically into the future to address and reduce brain drain and to increase brain gain by multiple strategic initiatives. To reduce brain drain and increase brain gain, we are introducing increased flows of funds into the health sector, improve the working and living conditions of our health professionals. We're beginning to train a much larger number of healthcare professionals. I will allude to this in a few slides. And we are also engaging with our diasporan associations in Europe, America, and across the world to facilitate the return of Nigerian specialists in from the diaspora. We are focusing on improving the living conditions of all our health professionals. We're building medical professional staffing quarters in all our new projects, and we're even going back into our old facilities to construct accommodation for our health professionals. This is an example of a project that is ongoing at the LASUTH. This is the construction of the residence doctors' quarters. We've also completed the refurbishment of the house officers' quarters at LASUTH, and the one is ongoing at Lagos Island General Hospital.
Other initiatives highlighted is the ongoing construction of the new Massey Children's Specialist Hospital, Psychiatrist Hospital, at locations including Ekpe, Ibaojo General Hospital, and other projects will also be completed in the next 12 months.
We are very cognizant of the climate change that we are experiencing. Everybody notices how hot it is becoming and how we are under intense shocks from the climate. And so we're building climate resilience into our health infrastructure into the future. On our right is the comprehensive healthcare center that's open 24/7 and supports a community of about 50,000 people. This is a picture of our new prototype design, and we've started to build 4 already, and we are about to start on another 5. We hope to have at least one of these in each of our LCDA areas. What is unique about this is the inside-outside design. It has a false roof on top of its real roof, so that you can be inside the premises, but your waiting rooms will be somewhat on the outside, but protected from the environment, so that you're not vulnerable to infection transmission from other patients. We're very proud of the fact that these facilities can be off the grid, in other words, totally independent of ECO or Ikeja Disco or generators if there is enough sunlight. This is the Shomolu General Hospital prototype derived from that master prototype. This is the Ibejuleki General Hospital derived from the prototype. And this is the Etiosa General Hospital, which will be built behind the MCC at Ajah, on that large piece of land there. The first of the prototypes that has been commissioned is the new Massey Children's Specialist Hospital. This is a 3D image, and at the moment you can see from these pictures that the buildings, both the hospital and its car park, have reached almost 70% completion. In this picture, we're taking His Excellency the Governor on a tour of the 10-story new Massey Children's 150-bed referral specialist hospital.
The Lagos State Smart Health Information Platform, a comprehensive digital ecosystem designed to unify patient records, referrals, emergency services, and interfacility communication, will also help to eliminate the chaos of bed hunting ambulances and end reliance on paper records. Government also gives assurance of its readiness to tackle any form of disease outbreak.
The Lagos State government is desirous of establishing a medical industrial and innovation hub to accelerate discovery and advances and advance our ability to discover, innovate, and create value-added biotechnology, something that was critically obvious during COVID, when we realized that we were totally dependent on many imported consumables, drugs, and analytes. And so we want to make sure that Lagos is not as vulnerable as we were during COVID by manufacturing many of our own consumables, discovering our own drugs, and developing our own vaccines. And we are going to be situating this innovation zone, Lasmizo, in the Lekki Trade-Free Zone corridor. And we're working to deliver the medical city, or the Lasmizo, which will focus on medical industry, medical innovation, and medical expertise. To wrap this all up, we have what we call the Smart Health Information Platform, known as SHIP. This is putting everything together. This is a very bold digital strategy of the Ministry of Health. All our facilities will be connected: primary healthcare, general hospitals, our tertiary facilities, our agencies. Everybody is going to be connected to the SHIP, so that His Excellency, the Executive Council, and the Ministry of Health and our partners, Ministry of Innovation, Science and Technology, will have real-time data on a daily basis and be able to observe the health-seeking behavior of Lagosians and use that kind of information to derive policy decisions.
All other agencies under the Ministry of Health were also applauded for their role in ensuring quality healthcare services in the state, and the government also says it's willing to invest more funds to create a smarter, safer, and more equitable healthcare system for Lagos residents.